Welcome to the latest episode of Out and About in Cabarrus County. Today we're at Mykonos Grill, located at Copperfield Boulevard and Lake Concord Road. I don't know if you can see the menu boards in the background, but they have great Greek cuisine, and as soon as we get finished filming, I plan to go eat some of it. It is my pleasure to have as my guest today Jodi Ramirez and Rebecca True. Rebecca is with Daymark Recovery Services. Jodi works with the Cabarrus County Sheriff's Department and also works with the Cabarrus County Manager's Office. And Jodi, exactly what is your title? I'm not sure exactly how to introduce you because you wear a lot of different hats.
My official title, Steve, is a law enforcement liaison for Kannapolis and Concord Police Departments and the Cabarrus County Sheriff's Office, as well as a project administrator for the County Manager's Office in our mental health initiative.
Okay, so you work with all three police departments in the county.
I do.
Yeah, and Rebecca, tell us a little bit about your role at Daymark.
Sure. I am the Center Director at the Cabarrus Center for Daymark Recovery Services. It's located here in Concord.
Great. One of the things that Jodi does is she staffs our mental health advisory board, and that's the topic of our show today, to talk about mental health issues as well as mental health services that are available here in Cabarrus County. So the mental health task force is a pretty diverse group of people representing a number of areas in the county. This was an initiative by the Cabarrus County Commissioners that was very much led forward by County Manager Mike Downs. How many folks do you have serving on that board at present?
So Steve, we identified 27 individuals that are leaders and decision makers in our community that serve on the Mental Health Advisory Board that meets quarterly. And from that, we also have over 30 individuals that work within the agencies, work with service providers that serve on our task force. And they meet each month to work on goals and objectives that were set by the advisory board.
Right. And so how would you describe the mental health needs in Cabarrus County? Is this I think a lot of folks out in our audience probably don't really have a handle on how serious the problem is this. Do we have adequate services available for folks that have mental health needs? If you could just talk a little bit about that in general.
I think there's a great need for mental health services, and I think what our Access to Care task force has identified is that there are not enough providers per citizens that are in need. So what they have been tasked to do is to look for providers and find out what is that, what is the access to care, what are the barriers that our community members who have mental health needs, what are they running into that we need to work with the advisory board on to get through some of those barriers.
I think one of the discussions that I've heard quite a bit is that based on some of the changes that the state of North Carolina made a number of years ago that tried to de-emphasize mental health care facilities, and if I understand it correctly, and I hope you'll correct me if I'm wrong, to try to more mainstream a lot of folks, that to de-institutionalize people that were in some of our mental health institutions. And so the things that I hear now are, we have somebody that is in need of help and we don't have a bed. We can't find a place for them. We had this discussion at our commission meeting talking with Cardinal Innovations about the number of Cabarrus County residents that have to be placed in other communities because we don't have those beds available for them. And then we hear about certificate of need from the state. The state has to give permission to increase those beds. So we have some providers that I have heard say, is 16 beds the magic number? We can't go beyond. I mean, we could handle more patients, but the state will not let us go beyond 16 beds. It's just either of you give me your perspective on that. Is that a good thing? Is that something that we need to push to try to change that rule? What are your thoughts on that?
I mean, I think, the county is lucky in that there are a lot of treatment providers that do provide treatment, such as Daymark. We provide outpatient services and intensive outpatient services. Our facility-based crisis center that is in Concord does provide those 16 beds for adults that need inpatient mental health stabilization or substance use detox. But it is limited to those 16 beds, and certainly if there are other needs and the beds are full, we have to look outside of the county to refer those folks that need services elsewhere. Certainly our goal is to keep folks out of the hospital, and so more beds certainly would be filled if we had them, and residential treatment is not available in this county, longer term residential facilities. So the county is lucky that we do have services. We just don't have the residential services, long-term residential services that some folks need if they are unable to maintain mental health stabilization in the community.
Right. And so I'm looking at some information here that says 18% of adults in the United States have some sort of mental health issue. With the population of Cabarrus County running around 205,000 people right now, and we only have 16 beds, then we're lucky to have them, but that doesn't come close to meeting the need, it doesn't seem. And so do you think we should be lobbying with the state to amend that certificate of need process to allow for more beds? Would that help ease the problem?
And I think more beds are always helpful. More types of services are always helpful, and not all folks need inpatient or residential treatment. They can receive outpatient or intensive outpatient therapy and have their mental health or substance use needs met. So I think it varies, and having opportunities for all levels of care in our community would be helpful.
Right. I think one of the other issues that I've heard discussed a number of times that I find very troubling is you have a family that perhaps has a child that has a mental health issue, and so they are seeking help, trying to find advice, where can I go, what can we do? In some instances, the answer is, well, Cardinal Innovations can help you if you're Medicaid eligible, or if you have private insurance, you can do this. Then I hear some people say, some of the facilities don't accept private insurance for whatever reason. I mean, it's a very complicated fact, and so I've seen situations before where parents are just, throwing up their hands and please tell me what I can do. Is that as complicated as it seems?
To navigate the system of mental health and substance use services is complicated, especially for the individual who has the mental health issue or substance use issue. Certainly I am pleased to say that Daymark offers services for any person with any type of insurance or no insurance, but not all agencies are able to do that. So certainly there are barriers to seeking inpatient services for someone maybe who has private insurance or an insurance that's not accepted, then there are those barriers for sure.
Right. Well, and I think you make a very good point. I was referring to those people that have advocates that are working for them, trying to help them navigate the system. If you're an individual trying to do that on your own while experiencing these problems, I can only imagine how difficult that would be. Several times you've mentioned substance abuse in the conversation. How big of an overlap is there between mental health issues and substance abuse?
Certainly there's a huge overlap, and doesn't mean that everyone that has a mental health diagnosis has also a substance use diagnosis, but they usually do go hand in hand on most occasions, for sure.
Do you think the substance abuse, and I'm strictly an amateur talking here, but I've heard some discussions of some folks with mental health issues perhaps self-medicate and get in problems with substance abuse. Would you say that's accurate?
Certainly it can be true, and at Daymark we do try and always provide treatment for both issues at the same time. So we're addressing those concerns all at once.
And Jodi, I know that One of the things that we've talked a lot about are the number of people in our Cabarrus County Jail that are there because of mental health issues. More than criminal activity, their mental health issues causes them to engage in behaviors that land them there. How, and I know that you and Rebecca both are involved with that, how are we trying to deal with that issue?
So, just to go off of what Rebecca had just said, is sometimes when they have the co-occurring issues, that is what lands them in jail, is they may go out and commit a nonviolent crime in which they are arrested and put into jail, which then hinders any kind of treatment that they would be getting if they were not locked up. So in the jail, we have gone ahead and we have a couple of things going on. One of the services some of the inmates can receive is what is considered doc in a box, which is telepsych medicine for those that have psychiatric needs in the jail. And the other thing that we're trying to do through the Stepping Up initiative is identify individuals that are arrested and booked in that have substance use or mental health needs, and we have a case manager that works with the individuals while they're incarcerated to get them plugged into services at Daymark once they are released.
Right. The investment of time and dollars in this program, to me, appears to be a very wise investment of our dollars. It is very expensive when we have some of these folks, and it's a commonly used term, but we call them frequent flyers, that are in this revolving door situation in and out of the jail. That's very expensive for taxpayers. So if we can provide these services and stop that cycle, hopefully we've improved somebody's life. We've eliminated taxpayer expense, and in the best case scenario, these folks are able to be productive and back in the economy of our county. Rebecca, Daymark provides staffing for that Stepping Up initiative at the jail, or anything you want to share with us about that?
Yeah, we are excited to be a part of that initiative in Cabarrus County. Cabarrus County is 1 out of 46 that initiated this program in North Carolina, and we are excited that we have this case manager working in the jail to try and connect these folks that have a mental health or substance use issue with treatment providers, could be Daymark or another provider in the community, with the goal, like you said, of decreasing recidivism rate and ultimately helping the individual lead a more productive, healthy life. Before they leave jail, they are also not having to, like we said before, navigate the system. It's a complicated system. Sometimes the individual is not sure where to turn, what phone number to call, where to go based on the insurance or the lack of insurance they have. So this case manager is able to meet one-on-one with these individuals before they leave jail and connect them to services, even give them an appointment date based on their release date, and they can then show up for an evaluation and be admitted into services, get the psychiatric care, maybe medication management and therapy that they wouldn't necessarily have been linked to.
Daymark, I know, is a larger organization. Are your activities exclusively in Cabarrus County, or do you deal in other counties as well?
So this initiative for Stepping Up is in Cabarrus County, but Daymark provides services throughout North Carolina. We run services throughout 33 centers in the state, providing an array of services from advanced access, emergency services, same-day access to mental health or substance use care. We have a mobile engagement team that provides services not only to this county but other counties throughout the state. As we talked about before, we have the facility-based crisis services in this county, as well as several other counties for adults that need that stabilization.
Yeah, and I think one of the reasons that I was asking the question is we are so proud of the amount of collaboration that occurs here in Cabarrus County. With the initiative, the Stepping Up initiative in the jail, the sheriff and all of his staff have been extremely supportive of that. Through our mental health advisory council. You know, we have folks representing all of the law enforcement agencies, our judicial system, our health care system. I mean, there's a lot of people around the table, and I think that that is one of the very important things about Cabarrus County that you don't always see everywhere, is the level of collaboration amongst folks. One of the things that I've heard discussed quite a few times is mental health first aid. And I know that there's been an initiative to offer those trainings throughout the county. Can you tell us a little bit about what that is and why folks should be interested in attending some of these sessions?
Steve, Cabarrus County has been offering mental health first aid since 2009. And this kind of training is just like CPR training. It informs family members, neighborhood, business folks of signs to watch for in individuals that might have a mental illness or be going into a crisis, and how an individual can stop and work with a person to de-escalate and maybe call for help and get some help coming for that person while they're starting to go into a crisis. We've been offering this training once a month throughout the year. It's very important if individuals are interested in signing up for mental health first aid. They can certainly call Atrium Healthcare, they can call Cardinal Innovations, they can call me at the Sheriff's Office, and we'll all get them signed up to host them. This year, Cabarrus County did their staff. The City of Concord has provided training for their staff. The Chamber is setting up the staff. So it's very important to our community to get this training out there.
Well, I have got a million more questions to ask, but we're running out of time here. So is there anything that you would like to add that maybe that I haven't asked before we finish up today?
I just want to thank everybody that is on the advisory board, because as you have mentioned, those collaborations, we've really seen some reductions at the hospital and partnerships with the hospital to help address the mental health needs there. The Health Alliance has stepped up. They have a peer support specialist as well as the hospital. So everybody's, our EMS is working on their community paramedic mental health arm. So everybody is thinking outside of the box of how can we continue to address helping our members in the community that need mental health services or substance use interventions, so that we can be a safer community to live in.
So I want to thank both of you for being with me today. I've certainly enjoyed the conversation. I feel like we're probably going to need to do a part 2 later on sometime. But thanks again to Micah Nose Grill for hosting us during their lunch period here today. And we hope to see you again soon.